Hello, my name is Congresswoman Barbara Lee. Thank you so much for inviting me to join you. We are gathering to celebrate the 33rd World AIDS Day. This year's theme is Ending the HIV Epidemic, Equitable Access, Everyone's Voice, which recognizes President Biden's firm commitment to ending the HIV epidemic globally by addressing health inequities and ensuring the voices of people with HIV are central in all of our work. On World AIDS Day, we can celebrate the progress in our global fight against HIV and AIDS, and also remember those who have lost their struggle against this disease, their families and loved ones, and the millions more who continue to live with and fight against it. While I recognize the progress that we've made together over the years, I stay committed to the work that remains. 40 years into the epidemic, we recognize that people are living longer with HIV and the rate of diagnosis have decreased due to domestic programs like the Ryan White and the Minority AIDS Initiative. Globally, our efforts through PEPFAR and the Global Fund to fight AIDS, TB, and malaria, both of which I was proud to work with my colleagues to establish, are dramatically reducing the burden of HIV and AIDS in developing countries. My fellow HIV/AIDS Caucus co-chair, Representative Jennifer Gonzalez-Colon, and I recently reintroduced the World AIDS Day Resolution and the Repeal HIV Discrimination Act of 2022. The World AIDS Day Resolution is a bipartisan effort supporting the goals of World AIDS Day. This includes continued efforts to prevention, care, and treatment services, and research programs for communities impacted by HIV and people living with HIV in the United States and globally. The Repeal HIV Discrimination Act will modernize laws and policies to eliminate discrimination against those living with HIV and AIDS. In countries where infections continue to rise and people still have not been reached by treatment, we need to drill down on where the gaps are and use all of our tools to speed up our progress. In our efforts to prevent HIV infections in adolescent girls and young women, it's critical that we pass legislation to permanently end the global gag rule and prevent a future president from unilaterally reinstating it. My bill, the Global HER Act, would do that. I'm proud that we were able to include it in this year's House Appropriations Bill, and I'm committed to working with the Senate to see it through to the finish line. As a member of the House Appropriations Committee, I will continue pushing for the highest levels of funding for HIV and AIDS programs focused on communities most impacted by the epidemic and the stigma that surrounds the disease. Thank you to the HIV/AIDS community and advocates for your tireless efforts, and I look forward to continuing the fight against HIV and AIDS both at home and around the world. Together, we will achieve an AIDS-free generation.
My name is Christopher Pride. I'm the Interim Director of Medical Care here at Positive Impact Health Centers, PIHC, in Atlanta, Georgia. We provide care for those living with HIV or those who may come in contact with HIV across the Atlanta metropolitan area. I remember it like it was yesterday, March 13, 2020, here in our center, prevention, client services, pharmacy, behavioral health, IT, clinic, we all switched at the drop of a dime to provide care during the COVID-19 pandemic. That following Monday, we were able to provide telehealth to our patients, which we now know as Zoom video or telehealth audio calls for those who didn't have video capability or who weren't familiar using Zoom. The only thing we couldn't do is blood work through telehealth yet. And so when people came into our clinics, we had to make a safe space by requiring masks, social distancing, and decreasing the duration of time while patients were in our facility getting their blood work drawn so that they can be eligible for services. Federal funding has helped tremendously during the pandemic. One of the most popular things it's helped out with is providing food and access to patients who were experiencing food insecurity in our communities, and being able to go out and get food. Unlike some of us who may have been privileged to order food through DoorDash or Instacart, our patients still needed help getting food during the pandemic. Another thing that the federal funding helped out with was tablets for patients who didn't have data connection, or for those who had data but didn't have a video connection. They were still able to see their provider face to face. What the greatest need for resources right now is work amongst education for undocumented patients. Undocumented patients I'm seeing in clinic, they're starting to come in with conditions that we normally don't see, like histoplasmosis, toxoplasmosis, not just pneumocystis, but opportunistic infections that they're entering care late. And I think that they may be afraid, and we need to have more resources available so that they know that this is a safe place and you can come here without the fear of being deported, which is terrible. Another resources we need, and more resources advocated towards, are for trans women, in particular Black trans women who are killed at disproportionate rates. Black trans women and other trans women need to know that if you come here, you can get hormone therapy. We can help you with your hormone therapy. We can help you stay undetectable and be able to live a long, healthy life, and that you also don't have to be afraid to come into our centers and be able to have your HIV controlled and access hormone therapy. If I had one thing to say to U.S. decision makers, it would be to say that we need to let the public know that if you're undetectable, you can have kids. If you're undetectable, you can have sex with your partner virtually at no risk and not pass HIV on to your partner. We need to really look at HIV criminalization. It's a shame that these laws are still in place, including in our state, and both parties seem to be on board with the process. We just need to get the policy to match the current science. What about our work here in Atlanta? I would say that we do the best we can do. We need support for South Atlanta, including Clayton County and areas around the airport that continue to have disproportionate rates and may need the most impact from ending the epidemic, including Clayton County. We need to let people know that in Georgia, HIV is still very high, and we're having a lot of new cases, especially amongst undocumented trans women and young people. And we should let people know that if you're living with HIV can be controlled and HIV won't be your problem. What we will begin to look at is high blood pressure, diabetes, hyperlipidemia. Those are the primary care conditions that our patients face once they're undetectable, and spreading the word about being undetectable and what that means and how empowering it is for our patients. Thank you so much for your time, and I appreciate this opportunity to talk with you guys today. Hope you have a great and happy holidays. Thank you.
Je réponds au nom de Congolo Béatrice. Je suis célibataire, la maman de 2 enfants. Je preste au sein de l'ONG Renoir et dans son activité PODI. PODI signifie le poste de distribution des ARV aux patients stables dans la commune de la Guinée, à Lubumbashi, RDC.
Est-ce que vous pouvez nous dire comment vous vous êtes adapté par rapport à l'approche de la pandémie Covid?
Ok. Bon, normalement, au PODI, on donnait les produits de 3 mois. Les produits de 3 mois à nos patients. Maintenant, avec la pandémie, nous avons changé. Nous sommes passés de 3 mois à 6 mois pour permettre aux patients de rester à la maison pour ne pas faire de va-et-vient et le confinement qui arrivait. On commençait à leur donner les produits de 6 mois tout en suivant les révolutions au téléphone. Le suivi se faisait au téléphone. Et il y a éligible à la charge virale, on prélevait à domicile sur les papiers biophare.
Comment PEPFAR vous a aidé à faire face à cette pandémie?
Ok. Oui, PEPFAR vraiment a intervenu dans le sens qu'il nous a rendu disponibles. Premièrement, les ARV. Les ARV étaient disponibles. Ils ne sont pas tombés dans la rupture, non.
il n'y avait pas de rupture et on nous a rendu disponible le matériel de protection individuelle des prestataires, entre autres le cache-nez, le gel hydroalcoolisé, les kits de lavage de mains.
Quel est l'autre besoin que vous pouvez avoir en dehors de tout ce que l'on vous a donné?
Bon, les besoins en tant que vulnérables, personnes vivant avec le VIH, vous voyez, nous sommes déjà fragiles. Vraiment, je trouve que la vaccination vraiment est nécessaire pour nous.
Et en dehors de la vaccination contre le Covid, qu'est-ce que vous pouvez demander aux décideurs américains?
Bon, aussi, aux décideurs américains, nous pouvons demander la continuité aux ONG locales. Et bon, je peux dire aussi rendre capable la mise en œuvre des activités. Et ensuite, je peux dire, il peut intervenir aussi dans d'autres financements, malaria aussi, la Petenville.
Ok. En dehors de ce que vous faites au niveau de Cody, qu'est-ce que vous faites encore de plus?
Oui, en dehors de ce que nous faisons, vous voyez, avant là, le PVV était toujours la main tendue. Maintenant, nous avons initié le PVV à faire les PVV sont des personnes vivant avec le VIH que nous sommes. D'être autonomes, nous avons organisé maintenant des groupes de cirque. Les groupes de cirque sont des groupes d'épargne et de crédit. Là où on épargne et puis en crédit, on rembourse ainsi de suite pour un peu faire face à la pauvreté.
Hello, my name is Abraham Johnson. I'm the HIV Community Engagement Officer for Treatment Action Group. This World AIDS Day, we have so much to celebrate with the many advances in HIV biomedical prevention and treatment. Although we have a lot to celebrate, we still have a long way to go as it relates to ending the HIV epidemic. In order to truly end the HIV epidemic, we have to be critical around addressing HIV stigma, HIV criminalization, and racism, all in which play a major role in ending the HIV epidemic. As a person who lives with HIV and grew up in the South, I know how stigma has played a role in not only my life, but the lives of so many other people. HIV stigma can be a determining factor in which a person decides to get an HIV test, whether a person decides to get treatment, whether a person chooses to disclose their HIV status. HIV stigma coupled with HIV criminalization laws are all unjust. Not only are HIV criminalization laws outdated, they don't reflect the current biomedical prevention. As we all know, undetectable equals untransmittable. HIV criminalization laws further perpetrate stigma and are plain out inhumane. In order to really end HIV, we have to take HIV criminalization laws off the book. As I think about resources that are important and where resources should be allocated to, more resources should be allocated to communities in the South, which are disproportionately impacted by HIV. Community-based organizations should continue to get funding, but not only to do funding around HIV stigma, but also HIV research. So as we think about resources and ending the HIV epidemic, it's time that we continue to center the community and HIV criminalization laws, and most importantly, let's have critical dialogue about racism and the role that it plays in HIV.
My name is Jean-Yves Petenville. I'm the head of the TB HIV program for Zami La Santé. My journey with Zami La Santé has started in 2005. As you already aware, Haiti is characterized by socio-political instability that impacts at a large scale the health outcomes of the Haitian population, including our HIV positive patients. There is no doubt that the COVID-19 pandemic has created new barriers for patients seeking care in our health facilities. Since the first 2 COVID-19 cases were diagnosed, as far as I remember, it was on March 19, 2020, the Ministry of Health has developed and implemented many strategies to reduce the spread of the disease. These include testing and treating patients, initiating quarantine and isolation centers, reinforcing contact tracing, encouraging physical distancing, providing PPE to care providers and patients, limiting travels, canceling gatherings such as sport events, concerts, churches, markets, and schools. In order to maintain the continuum of care to HIV patients, a bunch of measures were adopted and implemented across Zami La Santé sites. One striking point about Zami La Santé is that we have a community platform working on the field for many years. This is one of our biggest strengths. As you know, hospitals, health centers are places where people can get infected very easily. There was a trade-off between continuing care provision at the health facilities and keeping our patients safe. This is why at Zami La Santé, we have relied on our community health workers, commonly called accompagnateurs, to support our patients at the community level. One key strategy was to focus on community drug distribution and collection of samples for viral load testing, therefore limiting our patient presence in the health facilities. For those who came to the clinic, we provided them with multi-month dispensing of drugs to delay the next appointment date. At the health facilities, we established protocols to promote physical distancing and to reduce the number of patients in the waiting area while putting in place several hand washing stations. All patients coming to the clinics were required to wear a face mask. Keep in mind that all our clinical providers were equipped with adequate PPE. I just want to share a very short success story on patient retention during the COVID-19 pandemic. To be more specific, the success story is related to two major strategies that were adopted to improve our retention performance. What are those two strategies? They were appointment reminder calls and early drug refill. As you may know, since the start of the socio-political crisis in Haiti, national HIV programs have faced poor performance in terms of retention of patients and care. The Lower Artibonite region, where Zami La Santé intervenes, has been experiencing unprecedented levels of insecurity, with several localities remaining inaccessible because of increased gang violence. The COVID-19 health crisis has exacerbated the patient retention challenge, and Zami La Santé performance during the first quarter of the fiscal year 2021 was far from satisfactory. Following the performance presentation of January 2021, the Zami La Santé HIV program leadership has defined strategies to address the challenges related to patient retention. To alleviate the various concerns impairing the supplies of ARV to patients, the early refill strategy was adopted and implemented. It consists of calling patients about 2 months before the med supply appointment and inviting them to come to the clinics and get their medication refilled. Patients who agree to receive their medicines in the community are offered the option of having it delivered at their homes or a fixed point in the community through the community health workers. This strategy, adopted at all Zami La Santé supported sites, has helped to significantly reduce the number of misappointments. The list of patients with medication refill appointments was made available at the office of all providers, doctors, nurses, pharmacists, and social workers. Those providers check the appointment date for patients in order to make appointment reminder calls. The patients receive several reminder calls until their appointment date, 1 month, 2 weeks, and the day preceding the appointment date. As a result of the implementation of these two strategies, since March 2021, a significant improvement in the medication refill was observed within Zami La Santé network. Our medication refill performance went from 85% in October 2020 to 98% from March 2021 through October 2021. This improvement in the performance has been a combined effort from all the program staff, including our clinical providers and our community-based staff. In addition, the Zami La Santé Central Technical Team has ensured regular and constant monitoring of the implementation of these two interventions at the site level through weekly supervision and mentoring visits and regular phone calls to key site-based staff. Now, one of the greatest needs of the HIV program is the social and economic support for our patients. As you know, our country has been dealing with a continued socio-economic crisis which affects significantly our patients who are becoming more and more poor every day. Therefore, the US decision makers should definitely think about ways to improve the social and economic support so much needed in the care provision to our patients. I just want to share a very short success story on patient retention during the COVID-19 pandemic. To be more specific, the success story is related to two major strategies that were adopted to improve our retention performance. What are those two strategies? They were appointment reminder calls and early drug refill. As you may know, since the start of the socio-political crisis in Haiti, national HIV programs have faced poor performance in terms of retention of patients and care. The lower Artibonite region, where Zami La Santé intervenes, has been experiencing unprecedented levels of insecurity, with several localities remaining inaccessible because of increased gang violence. The COVID-19 health crisis has exacerbated the patient retention challenge, and Zami La Santé performance during the first quarter of the fiscal year 2021 was far from being satisfactory. Following the performance presentation of January 2021, the Zami La Santé HIV program leadership has defined strategies to address the challenges related to patient retention. To alleviate the various constraints hampering the supply of ARV to patients, the early refill strategy was adopted and implemented. It consists of calling patients about 2 months before their med supply appointment and inviting them to come to the clinics and get their medication refilled. Patients who agree to receive their medicines in the community are offered the option of having it delivered at their homes or a fixed point in the community through the community health workers. This strategy, adopted at all Zami La Santé supported sites, has helped to significantly reduce the number of misappointments. The list of patients with medication refill appointments was made available at the office of all providers, doctors, nurses, pharmacists, and social workers. These providers check the appointment date for patients in order to make appointment reminder calls. The patients receive several reminder calls until their appointment date, 1 month, 2 weeks, and the day preceding the appointment date. As a result of the implementation of these two strategies, since March 2021, a significant improvement in the medication refill was observed within Zami La Santé network. Our medication refill performance went from 85% in October 2020 to 98% from March 2021 through October 2021. This improvement in the performance has been a combined effort from all the program staff, including our clinical providers and our community-based staff. In addition, the Zami La Santé Central Technical Team has ensured regular and constant monitoring of the implementation of these two interventions at the site level through weekly supervision and mentoring visits and regular phone calls to key site-based staff. One of the greatest needs of the HIV program now is the social and economic support for our patients. As you know, our country has been dealing with a continued socio-economic crisis which affects significantly our patients who are becoming more and more poor every day. Therefore, the US decision makers should definitely think about ways to improve the social and economic support so much needed in the care provision to our patients. Thank you.
Hi, my name is Shay Thorne, and I'm the co-executive director of AIDS Alabama South and Shell Health Services in Mobile, Alabama, where we provide life-sustaining services to individuals living with and affected by HIV, as well as extensive prevention, education, and outreach services. I am also the co-chair of our statewide Ending the HIV Epidemic Coalition, End HIV Alabama, and I have been living with HIV for 11 years. AIDS Alabama South has adapted our services and continues to adapt our services during the COVID pandemic in various ways. To start, in 2020, we were the first organization within our local area to provide free and rapid COVID testing. For our programs department, we extended services which limited contact and increased the confidentiality and respect of our clients through providing drive-up services and drive-through services. For prevention, education, and outreach, we became extremely innovative by creating opportunities for our consumers and community to receive our services both digitally and virtually. Federal funding for AIDS Alabama South during the COVID pandemic has been extremely crucial to the success of our agency and to the success of serving our clients. We utilized funds such as Ryan White to increase capacity for clinical services, most specifically HIV treatment. This was especially important during a time when many of those living with HIV were having appointments canceled and or rescheduled, and they needed a safe space to come to ensure that they were happy, healthy, and comfortable in their daily lives. Right now, our greatest resource needs are less restrictive funding to support individuals through social services and other opportunities who are living with HIV and AIDS, as well as increased funding and opportunities for prevention, most specifically to expand and increase access to PrEP, the pill that prevents HIV. Federal funding, such as Ryan White, has supported our work during this time in incredible ways. Most specifically, it allowed us to open Shell Health Clinic. Shell stands for Sexual Health Education, Learning, and Living, and is a fully comprehensive sexual health clinic focused on HIV treatment and PrEP. This clinic has become a safe space for individuals living with and affected by HIV to ensure that they maintain their safety and their confidentiality. As you are currently considering HIV/AIDS funding and policies, I believe it is vital for you to understand that through increased funding opportunities for those living with HIV, we can ensure that we continue to have long-term survivors of HIV. Also, by increasing opportunities for funding for prevention, especially for PrEP, we can ensure that we end the HIV epidemic within our communities.